Hey guys, it's Dr. Nicole. I'm doing a video recording today of my podcast, The Learning Corner with Dr. Nicole. All right. Okay. So today I'm going to get started right away. I'm super, super excited. So if I repeat myself or get in front of myself, I apologize. However, I just got the great news. Let me back up. Okay. A couple years ago, I actually went and was talking to my husband and I said, oh, it'd be so nice if I could just have a company that literally could print supplements, that could make exact supplements that are needed, that can, I can go plug, this lab, this genetic company, this is what's needed. We're going to combine them into your needed supplement. And yesterday, I just got off the phone with a company who does just that. And I have gotten on board, and it is direct order. We can drop ship it to your house. It's comparable to the prices on other pharmaceutical level supplements, except the great news is there's less fillers because they don't sit there. They don't have to be mass produced. They're produced right there, 3 to 5 business days, I think it is, and it gets shipped right to your house to be consumed within the next couple months, so they don't have to have the fillers. And it's dosed exactly to what your labs say. This is the most amazing, most exciting news that I have had for you guys in a long time. Maybe just for me. Maybe the excitement for me is just like off the charts, amazing. Maybe I'm the only one who's going to be excited about this. However, I'm very pumped to announce this for my memberships, for my patients. I'm just excited. Okay, so here's how it works. Integrative Concierge. Old company was Perfect Touch Massage and Chiropractic. I still do all the great same things, but now we're under the name Integrative Concierge. And I'm going to keep saying this probably for the next 6 months. So everybody gets to understand that same company, new name, just to make sure that the general public understands that I do primary care, that I'm functional medicine practitioner, that I do concierge medicine, and that I'm taking 50 members. So as they fill up, everybody, the waiting list starts. So don't miss your opportunity to sign up as a member. Look at my website, all of that stuff for details. I just kind of want to go through this in a little bit more because I'm so excited. I don't know if you can tell my excitement, but got off the phone yesterday. I'm like, yes, this is exactly what I want to do. This is exactly what my patients need. It's a company, I already use Genova Diagnostics to do my labs and micronutrients, and that is what it's based off of. So as a member, you have the accessibility to get these labs and then to get specific nutrients for you. So here's how it works. You say, oh my goodness, I do not have health insurance, or my health insurance is not good. I'm looking for an alternative. And here I am. So healthcare reimagined, right? Health insurance reimagined, integrative concierge. So you say, what does integrative concierge and Dr. Nicole have to offer? Great question. So we start at basic memberships, all the way up to private memberships. We have basic memberships, wellness memberships, exclusive memberships, and then private memberships. I take on 50 patients, 1 doctor. I take care of you. You guys can come in for all this stuff. I'm making different changes so they will be reflected on my website. Like a new change is I'm going to be offering 10 to 20% off of all adjustments and medical massage, and it's only going to be available to, well, I haven't decided on medical massage yet, but for sure chiropractic adjustments. And it's only going to be available to those who are members. That's the exclusivity. That's what I'm trying to get to patients to understand is I will be the doctor of 50 patients, and you will have access to me for body work, for labs, for imaging, right? So we have everything from musculoskeletal concerns all the way up to genetic concerns and everything in between, because I want you to live the best, vital, right, happiest, all the life that you want to live, the quality that you want it to be at. I want you to have the understanding and the knowledge and the ability to advocate for yourself, to know how to do that, to get and develop that ability, right? So me as a doctor, I went to school for a really long time to understand, what does it mean to be an advocate for health? What does it mean to advocate for a patient? You didn't go to school and get it ingrained in you like, hey, you got to watch out for this. You got to ask these questions. You got to know these things, even navigating AI. Okay. And don't be ashamed when you come to my office to say, hey, I've been looking at AI. A lot of patients do it. They come to me when they get stumped, because guess what? You're going to get stumped. Everybody gets stumped, and that's okay. But that's what a doctor is for, is to go, hey, I know AI said this, but that's in this position, not in your position. So remember, like, these are all the things that you're going to understand, learn, that you're going to have access to, that you're going to be able to understand after becoming a patient here with me. My job isn't just to educate you on your body. Like, you know your body better than anybody. You do. My job is to educate you on what there is out there that you can understand, that you need to maybe take a peek at to get to your goal, right? So let's say your goal is, I want to lose weight. Simple goal. Not for everybody. Why isn't this working for you? Why isn't that working for you? Because there's so many things that you can do to lose weight. So guess what? Me, a doctor, maybe AI worked for you and said, hey, you need to do it this way. But a doctor, me, will come in and say, hey, I looked at everything. I looked at your intake. I looked at your physical exam. I looked at your labs. I looked at your genetics. And the best plan for you is this. And how we get there can be quick, can be slow, can be this way, can be that way. But this is what I would avoid. Okay. This is a no-go. Like, maybe carnivore diet's your thing, but it's not good for you. Maybe ketogenic diet is your thing, but it's not good for you, right? So those are the things that I'm actually able to tell you, like, based upon your body, your genetics, you get to do XYZ, and that's why these things don't work. And so that's kind of where I go with all my patients. But it's not just like what to eat, where to go, blah, blah, blah. It's like, hey, I slipped and fell, or I kicked something and I broke my toe. And I'm like, awesome, let's get an image of that. Do you have insurance? No. Okay, let's call in cash pricing. We'll call around and see how much it costs. Okay, you do have insurance. These are the two options that you have to go get imaging that take your insurance. Let's schedule that appointment. Okay, what if it's like, I don't know, what's a really common question? There's so many common questions in my office. Um, let's say it's, man, my shoulder hurts because I had a previous injury and now I don't know what to do with it. And I can look at your genetics and go, ooh, you have inflammatory markers. That's like your number one thing. We need to get inflammation down because pain shows inflammation, right? So those are the things that we can actually look at, that I can help you with. If you have things that you have had questions about the body, right? So I have a whole series of educational videos that I've created personally, that I have been developing my education program on. Hey, here's the 11 organ systems, right? This is what they do. This is why it's important. This is why you might have an issue with it, and we need to address that, even though you might not have looked at that before. Then that draws questions, right? Then you come in and you say, oh my gosh, Nicole, that video just triggered me to remember that I don't chew my food. Do you think that really makes a difference? And I'm going to go, yes, actually, and here's why. Or, wow, the small intestine, I didn't realize that if I saw things in my poop, that my body's not digesting the way it should. So those are things also that we talk about. We can talk anything that's going to help you get from where you're at to the lifestyle and to the end goal that you want to be at. And it everything in between. If it's spiritual stuff, I can help you get in line with that. If it's soul, right? So if it's your emotions, either I can refer you out or we can make a game plan of maybe it's just physical activity for you that you need to get your BDNF going, to get blood flow that really stomps depression for you. I don't know what that is until I look at it. But the 50 members that sign up, they have full access to me. That's where I am your health coach. I am your physician. I am your soft tissue manipulation, right? I am your chiropractor. I am all of that. That's where I want you to understand when you have a practitioner who's willing and able to refer out as quick as possible. Let me tell you a little bit about my past. Okay. When I started as a chiropractor, I had really good success with patients, but it wasn't because I was like a super healer or I was any different than any other chiropractor. Maybe the only difference is I referred out quickly. So we had goals. Say a patient came in and they got in a car accident, okay? They got in a car accident, they had whiplash, and as soon as I didn't feel that they were progressing the way they should, we either sent out for imaging, sent out for PT, sent out. We got the information, we got the labs, we got what was necessary to turn the corner for that patient, and we didn't wait. That's what I have to offer is I am great at puzzles, and the body is a puzzle. So we have our brain, we have our mind, will, emotions, we have, right? We have our organ systems, we have our body, we have all these parts. But how do they work together? And oftentimes people can't find a doctor that can understand how they work together. I'm a specialist in this and I'm a specialist in this. And it's like, yeah, I am great at medical massage and muscles are my jam. Okay. I've been doing medical massage for over 2 decades. Chiropractic, super awesome, right? I can adjust. I've been doing that for over a decade. But as I've learned the body and the levels of what our body is at, as I've been learning that, I've been going, how does that work together? How does the labs work in tandem with the genetics, work in tandem with our body, work in tandem with all of this? How does that work? And that's, I think, the difference is for me, when I get patients better, it's not that it's like, oh, good, you lost all the weight. See you later. You're going to gain it back when you go off my system. No, it's, I'm going to teach you how to fish. You're going to learn how to fish. I mean, you're going to be able to fish rivers and streams and ponds and the brackish water and the ocean water, in the deep, in the shallow, in the cold, in the hot. Like, you're going to be able to fish. Then, not only fish, you're going to be able to skin those things, right? Fillet them. You're going to fillet a fish that has gills, that has no gills, that has sharp gills, that have poison in it, that have every single aspect of a fish. This one you eat, this one you don't eat. This is why you eat. This one's fatty, this one's not fatty. This is, you get the picture. I give you those things because I want you to understand when you're signing up for a membership in my clinic with me, I am working for you. I am there to teach you, to advocate for you, to get you answers, to push you through, to give you hope and understanding of what your body is doing, how to expect it to do it, why to expect it to do it. I spend the time and I want 50 patients. I don't want 300 patients right now. Yeah, if I get staff members as I get big, which I intend to probably do, because when you have a good thing, it's going to grow. But that's where it's like right now, me personally, I want 50 50 people who need help, who need direction, who want to learn, who want to commit, who want the doctor on their side that's literally going to fight for you. Like, that's how exciting this is for me. I'm a little overboard. I get excited, but that's a good thing. This new nutrient thing that we started off talking about, I am so excited about it because I've been wanting this to happen for at least 2 years, if not sooner. But now I'm like, yes, it's here. It's arrived. We're able to do this now. So let's back up. Okay. Why join Integrative Concierge? Because you're going to have access to very specific, precise nutrition delivered based on labs. And don't worry, most HSAs cover it. So usually a lot of people will say, hey, can you send me your information? Let me check out my HSA, my FSA, right? All of these things. It typically covers it. You just have to talk to them and say, hey, I'm looking at going with Integrative Concierge, and their taxonomy says that they are a primary care clinic, chiropractic, and massage. Do you cover that? And what do you need from me? And so they'll go through all that. They'll say, yes, no, here's what you need, here's what's going on. And typically then you just run your HSA through there, or a credit card, or cash. So that's where a lot of people are going that way because, well, it gets you the care that you need. It gets somebody in your corner to make you understand, to help you navigate these things, who's on your side, who's excited for you, who is there for you, who you get their phone number, who you get all these things. So I'm making some changes on my website. As you probably have seen, I've changed it over to Integrative Concierge, and I am going to be making the adjustments according to what I will be doing and for the memberships. So please check out my website. That's going to be the most current area for what each level comes with and what maybe fits you best. I mean, there's always, like, say you want to do the basic level and it only is going to do either one lab or one genetic test a year, right? So you might say, hey, instead of doing this lab, can we do the one that you're talking about that links to the nutrition? And I can say, yeah, let's do that. And I might just do that anyways. So I'm thinking through all this stuff with the new information. So as you have questions, please reach out. Keep listening to my podcast. Please write to me. My brother and I are still working out kinks. So I'm super excited for Jim to come on board. We are going to interview him, and I'm so excited about that. So the interview is going to happen soon, and hopefully we can do video. We haven't worked out that kink yet, so I'm just, this is my first run and test on video myself. And so hopefully it can work via stream in the video, but I just have to work out how to download it, what to do with it. So stay tuned for that. So the big news is very specific nutrition coming your way. So you only have to take one bottle of pills. Now, it might be 3 pills a day. It might be 5 because some people really need a lot of nutrients, but the fillers are going to be less because it's made right there, right for you, literally, and shipped to your door with your name on it. Okay. And then it will have every single specific need that you have for micronutrients, magnesium, calcium, all those things. So think about this and go, wow, this is amazing. You don't have to have, I need to have 16 pills today. It'll just tell you, like, okay, take this much, do it here. This is the delivery system you need. It can come in capsule form. And for those of you that don't like capsule, it can come in powder form. So you can just put it in your water, put it in whatever, and drink it. Super excited. I'm going to be doing it myself. Stay tuned. Hopefully I can get this all done and get my micronutrients so I can, go through this with you. I do everything that I recommend for you guys. So that's another thing is I'm not just telling you what to do because, I think it works. And no, science backs this. I go through and do this. And then I watch it work. I work out kinks and I actually say, hey, this is what needs to happen. I have my own health journey. I got into this position because I was not getting help. I had nobody in my corner. I had everybody saying, well, you just need to do this and take this pill and do this. And every time I did, I felt worse. And every doctor I went to, I was disheartened. And I finally said, no more. I'm done. And then I realized that's what drove me to become a practitioner. Nobody had an advocate. I didn't have an advocate. You need an advocate. And that's where my heart goes out is I've been there. I've been in your shoes. I've had and dealt with chronic disease. I've dealt with cancer. I've dealt with a lot of things. And here I am on the other side going, wow, I might be getting a little gray hair. Should I dye it? I'm not sure. Where my weight's in check. I haven't had issues with menstruation. I haven't had any cancer scares. I haven't had hormone disbalance. I haven't, these chronic diseases. Like, I'm not just telling you what to do. I've been there. I've been through the hardships. I've had nobody to help me. It's hard. And you get somebody. And that's why I do what I do. And I'm so excited to actually like share and be able to be in your corner. That's where I get pumped. I get so like, ooh, we finally get this going on, like this is finally connected. So the resources are there and I'm here to answer your questions. And I hope that you understand there's hope for you. There is somebody there for you to help you. Sign up, come join. Let's do this together. And get you healthy, get you to your goals, get you understanding, whatever that is. So anyways, I have to actually get going because I have a patient coming in soon, but I just wanted to drop this announcement and put out this podcast for you. I will probably be publishing it right away. So have a great day. I hope all is well. And until next time, the Learning Corner with Dr. Nicole.